This is Healthcare Now Radio's Trending Now. I'm your host, Jared Johnson. Join me and my guests as we discuss the latest trends that are in the news or getting social media traction in the universe of healthcare and health IT. It's a fast-paced 30 minutes, so sit back and listen in as we kick off the show with what's on trend now. Today, our theme is An Educated Patient Pays Better. There's a lot to talk about here. We're going to start with covering a headline about a majority of hospitals not being fully compliant with CMS's price transparency rule. And then we're going to dive into the patient payment journey. To help me with that, I have a very special guest with me here today. Please give it up for Voddiraju, founder and CEO of Health iPass. Raj, welcome to Trending Now.
Jared, thank you for having me. Such a pleasure to be on this show.
Well, I'm always interested to hear founding stories for once. I find that there's a common thread with founders, that there's usually an unmet need in the world, and there's someone who comes along with a passion for building a business around meeting that need. I'd love to hear any of that founder story that you're willing to share with us, and then anything else you'd like to share about yourself and your background.
Yeah, I think that's both are obviously very important and related to each other. I come from a large family of physicians and physician entrepreneurs, Jared. I also became an investor in a chain of urgent care clinics. But it wasn't until one of my family member had a experience with healthcare when I went on a high deductible health plan myself that I realized that the fundamental law of commerce is broken in healthcare. And what I mean by that is you go into a McDonald's, you pay before you receive your product. You go to a Starbucks, you have to pay your $10 or whatever before you get your fancy cup of joe. And that is typical of all retail experiences all of us have. When it comes to healthcare, it's absolutely the inverse, right? We don't know what things cost. And to the merchant, they have no guarantee that they'll get paid. And that's what I saw from both the perspective of what physicians in the family were talking about over the years. My own experience as a consumer obviously taught me one side of the story. I had till then been a CEO or a business leader for mid-sized businesses, few hundred employees, and saw what changing deductibles was meaning in terms of the pocketbook to a consumer. And therein, I saw that patient is going to be the new payer. And as you highlighted, an educated patient pays better was the fundamental thesis. And that's the genesis of Health iPass. I'm a techie by education, by the way, and I've always been very inquisitive. The best career advice I got was from my mom, who was a very, very busy OBGYN doc in India when I was growing up. And she always said, diagnose before you prescribe. And we spent a lot of energies understanding the challenges in patient payments before we started Health iPass.
Well, I love that. That's actually a really broad application of that. Diagnose first and then prescribe. There's a lot of wisdom in that beyond the medical field. That's great advice. I mean, when I start thinking about some of the applications in a career journey, for instance, I know there's a lot of folks on the market who are exploring one way or the other about considering something new or just wanting to know if there's another path for them. That's really sage advice. I love that. Well, I'll tell you what, let's dive into this. Let's start now with what's on trend. The trend that we're going to talk about is an article that I found in RevCycleintelligence.com. It was about hospitals that aren't fully complying with the price transparency rule. This article was published on February 8th. And the headline was, only 25% of hospitals are complying with the price transparency rule. It referred to a report of over 1,500 hospitals that were reviewed that were non-compliant with at least one requirement of the price transparency rule between December 2022 and January 2023. And it does go on to say a little bit about, not everyone is being fully non-compliant here, but it did say that there are enough of a majority of hospitals that are not fully compliant that it was interesting to me. And this does refer to, of course, the most recent rules from CMS about what a hospital has to show and make available to a consumer about what certain parts of their journey are going to cost. I'm curious what you think about, just first and foremost, the price transparency rule itself, and then anything just about this trend of hospitals not being completely compliant yet.
Yeah, again, in some ways, probably not too shocking because this is a pretty big and sea change in terms of how providers have always not had to worry about price transparency, Jared. And one of the key aspects of the price transparency law is the stipulation of not just posting what their gross charges are or the discounted price if you pay in cash. But there are two parts of the stipulation that are now getting into a territory that has long been very sacred, so to speak. And that is to be able to expose what their negotiated price is specific to individual insurance companies on one side, and also provide a range in terms of both the minimum and the maximum prices for a negotiated charge. So, for example, if you were to say an ultrasound as a simple example of a service, not only is the health system supposed to publish what their standard rate is for an ultrasound or what your discounted price of an ultrasound might look like, but they now have to go in and say, if you are on Aetna or if you are on the local Blue Cross or Humana or Cigna or whatever the insurance company is, they have to now disclose what price they negotiated with the insurance company and in a de-identified kind of form, show what the min and max are. And that's the part that I was saying is a bit of new territory that the stipulation is obviously going towards. And so not surprising that, when you look at the compliance, 25% are fully compliant, 75% are non-compliant in some form or fashion. And typically it is about the contracted rates for individual payers. Then that's where the bulk of the non-compliance kind of comes from.
Yeah. The requirement itself, as described in the article, refers to the most recent, again, CMS guidance that went into effect on January 1st, 2021. And it requires hospitals to post prices online in a user-friendly format. And what they mean by that is to be completely compliant. A facility has to publish a machine-ready file, a machine-readable file, rather. It has to include the standard charges, like you were saying, and those discounted cash prices. Not just for one thing, this is where I see the level of complexity here is for all the items and services for all health plans and the standard charges all displayed with actual prices or a price estimator tool. And it says that it has to be for the 300 most common shoppable services. So there's one reason in my mind that that's not fully compliant, that not everyone is there yet, because this isn't easy. There's also what I've seen are ways to kind of technically be compliant, but for it still not to be that useful for a patient. And I think, there's a lot of area there that does have to do with some of the things I think we'll get into a little bit later about patient payments. And that journey is probably meant to, I feel like it came from a good place. It is meant to not have as many charges completely shocking to a patient, not have as many surprise bills, for instance, to be part of this movement of patient empowerment. And yet there are ways to be technically compliant and not get that much value or usefulness to a patient. So I do think it comes from a good place, but there's still a lot of room for improvement.
No, and absolutely, like you said, it's not just that there are 1,500 hospitals, according to the article, that are non-compliant, right? You're talking about very large systems like the HCAs, the Tenets of the world. And, from a regulation and regulatory intervention standpoint, Jared, I think it was very, very required, regardless of which end of the political spectrum, a particular person sits in. Avoiding surprise bills and all moves towards improving transparency, I think, are very, very welcome and necessary for us in the US healthcare system to begin to embrace the need of the consumer who is now responsible for a larger portion of the bill. And I think this regulatory intervention, whether it goes far enough, and what the phasing of additional regulatory intervention may look like, it's a very, very welcome change in terms of helping people understand, just like any other part of our everyday life, right? The basic law of commerce has to be restored. Price transparency is an important part of that.
Yeah, that's a great point. As I mentioned earlier, our theme today, Raj, is an educated patient pays better. I love that you were able to even wrap that into your bio and kind of the DNA of Health iPass. It seems like a simple concept. I'll tell you, like on the surface, I don't think anyone would disagree conceptually, but there's a lot there. I wonder if you can unpack this for us for a little bit. Why is it so hard for consumers to be educated about their payment journey?
Yeah, I call it the 3 P's of this world. The first P is the patient, Jared, which I'll expand on. The second P is the payer or the insurance company. And the third P is the provider or the physician, right? Physician group or whatever care setting that you kind of go to, right? The reality is, if you ask 97% of Americans, we don't understand plan design and health plan design, right? We're all stuck from the days of if I'm on a government insurance, it pays for everything, or I was on a very, very low deductible. If I have the insurance, I'm pretty much covered kind of a mindset. And it takes a lot with the changes in plan design, the changes in what a consumer sort of understands. And that's the primary responsibility and self-awareness and self-education requirement of the patient. The second is the payer, and most payers guard and force the providers to guard what their contracted rates are. Insurance companies, when you think about the average American, we may understand the notion of a copay, we may even understand the notion of a deductible, but lots of other things in terms of plan design, whether it's who's in network, who's out of network, what is your out-of-pocket maximum, what is coinsurance, what are the different carve-outs, right? What are your benefits if you are met with an accident, unfortunately, and you have to go through some rehab or physical therapy, right? That's a different set of benefits than your overall plan design. So there's a lot that the payers have to be able to do. And then comes the provider, right? Does the provider have a good understanding and a good set of tools to provide the transparency that is required in the process? So all 3 parties are somewhat guilty, if you will, in terms of the mess that we are in today. And all 3 of these parties have an obligation to make this easier and better for the overall system to become simpler and easier for all 3 parties.
Thanks. That's some great context here. If you're just now tuning in, I'm Jared Johnson, and you're listening to Trending Now on Healthcare Now Radio. I'm speaking with Raj Voddiraju, founder and CEO of Health iPass. All right, let's get back into it here. Let's talk about some of those barriers, Raj, that you just mentioned that have historically made it hard for patients to be educated about their experience. What are some of those barriers, and how are we overcoming those barriers?
Yeah, I think if you look at overall health insurance in America, on one side you have Medicare and Medicaid population. And generally speaking, the government has done a pretty good job of educating folks on what their Part A, Part B, Part C, Part D benefits are and how it works and all of that, Jared. When it comes to commercial insurance, on the other hand, if you look at the vast majority of employer-sponsored health insurance for all of us, perhaps for both you and me on this call, the reality is something like 57% of the employer-sponsored insurance is in a bucket called high deductible health plans. And this is where payers have created plan design around large amount of patient skin in the game. And there is an overarching plan design, and there is plan design that is specific to the different types of services that you might, healthcare services that you might get. And from a barrier standpoint, right, just understanding plan design, and is it the employer's responsibility or is it the payer's responsibility to best educate the consumer or the patient, is one big barrier in terms of understanding the patient out of pocket, if you will. The second is healthcare has been slow somewhat compared to other industries in terms of embracing technology. So a lot of times you'll go in and even trying to get into getting an appointment, for example, you have to call somebody, speak to a human, and all the things that we take for granted, whether you take an appointment at a salon or, any other place for that matter, right? Buying a ticket for a sporting event or what have you. Those type of experiences, have not been true in the healthcare context. And that you can literally extend through the entire journey of the patient, right? From scheduling to how they complete their paperwork and complete their check-in process, what kind of consents they have to sign off on, all the way to it's still the same industry where the only industry I would say where the bulk of the post-visit patient dollars are collected through the infamous paper bill, right? The medical bill that, lots of people complain they don't understand. The provider side experience certainly requires a transformation in terms of making it easy for the consumer.
Gotcha. Well, you mentioned identifying who's even responsible for educating patients is a barrier. Who in your mind does that really fall onto at the end of the day? In terms of who should be responsible?
It does unfortunately come from everybody, and everybody has a role to play here, right? I would start with the patient themselves, right? It's their money at the end of the day, and it's their out-of-pocket, it's their health or their family members' health. So they have to play a very, very important role in taking ownership, if you will. Second, the patient's employer, to the extent it's employer-sponsored health insurance, certainly has a role. And whether they do it themselves through internal HR departments, whether they use third-party services like a ADP or a PEO or what have you, right? The HR teams on the employer side certainly have a responsibility in terms of educating their patient base. And, third, the payers themselves, I think you're seeing a pretty significant change, particularly over the last 5 years or so, I would say, Jared, even more so than before, where the payers have made it simpler and easier for a patient on their plan to be able to understand their benefits, to be able to, price shop, if you will, understand who are the local providers that can potentially provide them the best service across certain set of what I'll call shoppable services in healthcare. And that's, I think, a big change that you're kind of beginning to see. And last and importantly, if the provider expects to get paid and get paid on time, their obligation is also to educate the consumer and set the right expectation in terms of what could be the patient out of pocket before they get a shock in the mail 2 months later or 3 months later, as it typically happens now.
How important is being paid on time to the rest of everything that the practice does?
Yeah, obviously massively important, right? Today, the patient is the new payer, and in a lot of groups, as much as 20-30% of the overall reimbursement is coming from patient out of pocket. There's a massive premium in a system's ability to collect better from their patients, collect first and collect better second, I would say, Jared. It's shocking, right? When you look at the net collection rates of most healthcare groups, it's anywhere from 40 to 65, 67%. If a Starbucks only got 40 to 65% of their expected cost, right, and they had to send you paper bills and chase you instead of collecting up front, they would be out of business in no time, right? It's so backwards and almost hard for people from an outside-in perspective kind of even imagine the experience. So I would say collecting first and collecting better and faster are definitely very, very critical to the ongoing success of a lot of these not-for-profit systems that have to carry forward their mission, as well as for-profit systems, including small independent practices, very, very key for them to be able to collect. And I think as the title of the show an educated patient pays better. And we have proven over tens of millions of patients that have used our platform that, generally speaking, people are not out there to stiff their doctor. They do want to pay. It's about the rest of the environment and whether it's conducive for people to truly understand what their out-of-pocket is and have easy ways to fulfill their part of the obligation.
So what specifically does a patient need to be educated about when we talk about this theme? Is it just how much the service that they're planning to have done costs with their current coverage? Is it being educated about options, about being able to shop those shoppable services? What all does the patient need to be educated about?
Yeah, I mean, ultimately, the patient is trying to find the best value for the service, right? First things first is getting the qualified clinical help that is necessary for them or their family member to get better, right? Nobody wants to be in front of a doctor. It's a moment of great anxiety for anybody. And price comes kind of second, so to speak, right? But it's important in the backdrop of more patient out-of-pocket, more consumers like you and I having these high deductible health plans. So price certainly comes into play, especially if it's an elective service or something that is not a life emergency or what have you. What matters to the patient ultimately is what their out-of-pocket cost is. And even before I started Health iPass, right, I felt, if I'm on Blue Cross, it's the same price everywhere. And that's far from the reality. The reality is every individual provider or group has contracted with Blue Cross for a specific service. And to the extent that you are aware of what the service is and what the alternatives are, you are in a better spot to now leverage the tools that are available, whether it be from your insurance company's portal, whether it is tools like this mandate that requires hospitals and healthcare providers to publish rates and their contracted fee schedules. You're now in a place where you can figure out whether it's price, whether it's convenience, whether it's clinical efficacy, what drives your decision in terms of choosing a particular provider. And as we were saying earlier, it's the patient's responsibility. Parent groups, I think, and patient affinity communities, if you will, certainly play a role. But certainly the payer as well as the provider have the responsibility to make sure that it's not a shock in the mail 2 months or 3 months after a service is rendered.
Are there other stats or data or research that you've come across about just the benefit of educating patients and or how it helps for them to make it easier to pay in the first place?
Yeah, no, very much so, Jared. In our own business as Health iPass, right, we are here to make it easy for patients to pay. And our customers, which are healthcare providers, from small physician practices all the way to the largest of the large. And a couple of years ago, we actually looked at over 10 million patient check-in and patient experiences through our platform. And we were able to prove with data that when a patient checks in through Health iPass, the provider gets paid 98 cents on the dollar, 97.4 cents on the dollar to be more specific. And it's an astonishing number in contrast to the 40 to 60% collection rates that most providers have. And it touts and shows proof that the more you educate a patient, the better payer they become. And nobody's out to stiff their doc. They're really trying to make sense of what their responsibility is. And the more you do that upfront, the better it is for not just the patient, but also for the provider to be able to sustain and run their business, so to speak. So we call it the 97% club. It's our clients that, through the use of our platform, have been able to make sure that they're delivering so much value for their own groups. And that's probably the best proof point I can offer in terms of yeah, an educated patient indeed pays better.
I love it. Well, I love that we've been able to dive so deep into this topic. And any other final words about this topic or any other trends you've been watching?
We're about the taking friction out of the payment experience, right? So a lot of what we focus on is how do we extend and provide alternative and more flexible payment options, whether it is Apple Pay, Google Pay, digital wallets, tokenization, and also the trend of paying over time, right? Offering payment plans or buy now, pay later as a category of solutions that are out there. Also thinking about patient financing, and all of these are really about extending the payment options for the patient. Besides that, and the price transparency, we certainly think about the patient experience end to end in the process, Jared. So how can we make this easy for patients to schedule when they want to schedule? How do we make it easy for them to check in right from their phone before they ever set foot in the clinic? How to present bills digitally and make it easy for people to pay? Like all of those experiences are very, very critical. And I don't want to just think about just the patient, right? When you think about the provider, from the hodgepodge of tools and merchant processors and gateways and so on and so forth, if you look at the overall solution set that we offer, we think about the provider experience and particularly around ease of payment reconciliation. And those are all big trends that we kind of watch, and not just watch, obviously internalize and institutionalize into product capabilities that we offer to our clients. And many, many, many millions of patients ultimately are the true beneficiaries of the work that we at Sphere are doing in this regard.
Outstanding. Well, I want to thank our listeners for tuning in to this episode where we've talked about how an educated patient pays better. And I want to thank Raj, my guest, for joining me today. To learn more about Health iPass, you can find them at healthipass.com. You can learn more about today's show on our program page at healthcarenowradio.com. And make sure you follow the show's hashtag at TrendingNowHC and follow me on Twitter at JaredPiano. Until next time, if it's happening in healthcare and it's now, it's on Trending Now.